Hello everyone and welcome. Today we're going to talk about mumps, an infectious disease that affects both children and adults. In the next few minutes, we'll go over what mumps is, how it spreads, its symptoms, and most importantly, how it can be prevented. Let's dive in. Mumps is a viral infection caused by the mumps virus, which belongs to the paromyxovirus family. It's primarily known for affecting the parotid glands, which are located near your ears. These glands produce saliva, and when they become swollen, you get one of the most obvious symptoms of mumps: painful swelling in the cheeks. Mumps is highly contagious and spreads through respiratory droplets when an infected person coughs or sneezes. It can also spread by sharing utensils or through direct contact with an infected person. So, what are the symptoms? Early on, mumps can feel like a regular cold or flu. You might experience symptoms like fever, headache, fatigue, and muscle aches. But the hallmark symptom is swelling in one or both of the parotid glands, which makes the face look puffy or chipmunk-like. It's important to note that not everyone who gets mumps will have noticeable swelling, and some people may have only mild symptoms or none at all. However, in severe cases, mumps can lead to complications. There is no specific treatment for mumps, and it usually resolves on its own. Treatment focuses on relieving symptoms and supporting the immune system. Some common recommendations include resting and staying hydrated, taking over-the-counter pain relievers such as acetaminophen to reduce fever and discomfort, applying warm or cold compresses to the swollen area to ease pain, eating soft foods and avoiding sour foods that can cause more pain in the swollen salivary glands. It's important for individuals who are infected with mumps to stay isolated for at least 5 days after the onset of swelling to prevent spreading the virus to others. As we said before, many cases of mumps resolve on their own, but it can lead to complications, especially in adults. These complications include orchitis, inflammation of the testicles, which can cause pain and sometimes infertility, meningitis, infection of the lining around the brain and spinal cord, which can cause headaches, nausea, and stiff neck, ovaries, inflammation of the ovaries in women, deafness, rare but permanent hearing loss can occur due to the infection. Fortunately, most people recover from mumps without severe complications, but these risks highlight the importance of taking preventive measures. The best way to prevent mumps is through vaccination. The MMR vaccine protects against measles, mumps, and rubella. It's typically given in 2 doses, one at around 12 to 15 months of age, and the second dose between 4 to 6 years old. Thanks to widespread vaccination, mumps cases have dramatically decreased in many countries. However, outbreaks still happen, particularly in places where vaccination rates are lower. If you suspect you have mumps, it's important to stay home and avoid contact with others, especially those who haven't been vaccinated and who have weakened immune systems. Mumps is typically diagnosed based on characteristic symptoms, especially parotitis, swelling of the salivary glands, and the history of potential exposure. Laboratory tests such as PCR or serological assays are used to confirm the diagnosis. It's also crucial to visit a healthcare professional for a proper diagnosis. And remember, mumps can take about 7-10 days to fully resolve. To recap, mumps is a viral illness that can cause painful swelling in the cheeks, among other symptoms. While it's often mild, it can lead to serious complications, especially in adults. The best way to protect yourself is through vaccination. Stay safe, stay healthy, and always consult with your doctor if you have concerns. Thanks for watching, and I hope you now have a better understanding of mumps. Thank you.